Hello friends, I am Dr. Randeep Singh, a medical oncologist and a cancer specialist at Oncomed Clinics, as well as heading the department of medical oncology at Narayana Health, Gurugram. Today we will be talking about colorectal cancer. It is a scientific term which combines two types of cancer, colon and rectum. Colon is a large intestine. In the common man's world, the term is large intestine, and rectum is the last part of the large intestine just before the anus. Whenever we talk about colorectal cancers, these are usually in the form of abnormal growths arising from the intestines. If it is benign, usually we call it as a polyp or a benign tumor, and if it is cancerous, we call it as cancer. That means this abnormal growth is having the potential or the tendency to spread to the surrounding structures as well as to the distant parts of the body from your large intestine to liver or other parts of the body. Talking about colon cancer and its risk factors, there are some modifiable and non-modifiable risk factors. What do we mean by modifiable? Modifiable are related to your lifestyle and diet. Diet such as low liquid intake, low roughage diet, more of junk foods, and habits such as increased consumption of alcohol, obesity. These all are modifiable or lifestyle related risk factors. There are some non-modifiable risk factors, among which one of the most common, or one of the not most common, one of the most important is genetic in origin. Sometimes you inherit genes from your parents which can lead to this cancer. Also, there is a disorder called IBD or inflammatory bowel disease, such as ulcerative colitis or Crohn's disease. And when you have this disease uncontrolled or poorly controlled for many years, that can also predispose you to colorectal cancer. Let us talk about signs and symptoms of colon cancer. Symptoms of colon cancer can be non-specific, such as weight loss, anemia, which is purely due to loss of blood in the stools, vague abdominal complaints, vague pain in the tummy, incomplete defecation, that is, you get the sensation that you are not able to evacuate your bowels completely. Sometimes if you have a growth in the lower part, which is called rectum, you can have false diarrhea, you can have lot of passage of mucus and blood in the stools. Sometimes fresh blood coming out of the anus can also be a sign and symptom of colon cancer. Usually these signs and symptoms are, they can easily overlap with many other diseases of the bowel. So whenever you have these symptoms prolonged, say for 2 weeks, 3 weeks, it is always better to consult a family physician or a gastroenterologist or an oncologist, because you shall not panic that you are suffering from cancer. It can be some other complaints also. But if they are persistent, then please consult the concerned doctor. Let us talk about, can we prevent colorectal cancer? And the answer is yes. We can prevent colorectal cancer by, first is our lifestyle and diet modifications. Have a good roughage diet and maintain an average weight, and keep your alcohol and smoking habits to nil or to as minimal as possible. Also, when we talk about prevention of colon cancer, we can adapt for screening. Screening is a term which is used for those healthy people who are at risk or who want themselves to be checked for colorectal cancer. And for screening, the test is called colonoscopy, where an endoscope or a telescope is passed through the anus, and we have to do this test once in 10 years. And this is a screening for healthy population, those who may be at risk or those who want to get themselves screened for colorectal cancer. Anyone who is above the age of 50 years shall get a colonoscopy once in every 10 years till the age of 70. So friends, let us stand together and fight against colorectal cancer by spreading awareness about its disease, early diagnosis, early treatment, and maintaining a healthy lifestyle. Thank you.